Welcome to the setup and maintenance instructional video for the Direct Supply Attendant Vital Signs Monitor. The Attendant Vital Signs Monitor is an all-in-one quick solution for obtaining continuous or spot check vital signs. It measures temperature, pulse oximetry, blood pressure, and heart rate. To begin using the Attendant Vital Signs Monitor, first unpack it in an area with sufficient room to work. Once unpacked, plug the AC power cord into the rear panel of the monitor. Then plug the AC power cord into a properly grounded outlet. When the AC indicator is lit, the monitor is charging. If the battery needs charging, the indicator will flash. The unit will take 6 to 8 hours to charge prior to using it for the first time. The unit can also operate when plugged into a wall outlet. While ordering a mobile stand is optional, stands are recommended to enhance both portability and usability. If you have a mobile stand, follow the provided instructions to attach the monitor to the stand. Next, attach the blood pressure cable connectors shown here in blue. To do this, connect the non-invasive blood pressure cuff hose to the lower left corner of the front of the unit. Unlike other models which may have attachments that fall off and interrupt the blood pressure reading during assessment, you will notice this metal plug twists in to securely lock into place. This helps ensure the plug cannot detach while you are trying to obtain a resident's blood pressure reading. Now, attach the appropriate blood pressure cuff to the other end of the blood pressure cord. Twist to lock into place. For resident safety and best performance, use only the cuff and hose that are provided with the unit, or a replacement cuff purchased through Direct Supply. Next, attach the gray pulse oximetry connector cable to the input connector on the left side of the unit. Then attach the fingertip pulse oximeter to the connector cable. For the safety of your residents and the best device performance, use only the provided pulse oximetry sensor cables and sensors supplied with the unit. Take the oral thermometer probe with the coiled cord and plug it into the temperature probe connector on the right side of the front of the unit. Then, place the probe well into the top of the unit. Use only those temperature probes provided with the unit. Place the probe into the probe well. Finally, you will notice that the unit has a handy reservoir made especially to hold thermometer probe covers. Additional temperature probes and probe covers are available through Direct Supply. For cleaning, be sure to always follow your community's cleaning procedures. The entire surface of the monitor may be cleaned using pre-moistened isopropyl alcohol wipes. Also, be sure to wipe all surfaces of the sensor and cable. Be sure to clean the monitor attachments, including the pulse oximetry sensor and cable, blood pressure cuff and cable, and temperature probe and cable. Never allow any liquids to enter any monitor connector. If a connector does come in contact with a liquid, clean and dry thoroughly before reuse. If you have concerns about monitor safety, do not use the monitor and contact Direct Supply. Your Attendant Vital Signs Monitor may come with an optional printer. To replace the printer paper, follow these simple steps. First, open the door by gently pulling on the printer latch on the left side of the unit. The door should tilt open. Reach in and remove the empty paper core by gently lifting it with your thumb and index finger. Insert a new paper roll and ensure the paper roll is properly aligned as shown. Pull the paper towards you until approximately 2 inches of paper have been unrolled. Align the paper with the paper attached to the printer door and close the printer door.